A huge obesity study done at Yale found that, shocker, bias and discrimination against people who are overweight is alive and kicking. Hey folks, Laci Green here. Welcome back to D News. Yale researchers are saying that weight bias in society is nearly as prevalent as racism, even in places where you would hope that you wouldn't find it, like, say, the doctor's office. The study was huge, with data from 350,000 plus people, 2,500 of which were doctors. 1/3 of the doctors openly admitted to stereotyping their heavy patients as sloppy, weak-willed, and lazy. Female patients experienced disrespectful comments twice as often, and biased treatment from health professionals kicked in at a BMI of 27 for women and 35 for men. A separate study done at Johns Hopkins analyzed 200 appointment transcripts and found that compared to thin patients, heavy patients were significantly less likely to receive empathy from their doctors. Normally, doctors offered simple comments to show concern, like, "I'm glad you're feeling better. I know it's frustrating to feel this way. Stay strong." But if the patient was overweight, these comments were nearly absent. Maybe on the surface, the lack of support seems like, okay, well, that sucks, but it's not that bad. But when you look under the surface, it might in fact be that bad. Study after study shows that weight stigma leads to poor quality of care for patients. Patients who get empathetic care from doctors are far more likely to follow their advice and have better health outcomes overall. However, misplaced comments about someone's weight from doctors made it less likely that they would go seek out preventative care. And what strikes me as really troubling is that so many people who are overweight have their weight blamed for unrelated issues. I'm talking about people with sore throats being told to treat it by losing weight, asthma confused with depression, undiagnosed broken bones. Yeah, weight is certainly related to different health conditions. There's no doubt about it. But most doctors acknowledge that weight is not intrinsically linked to every single health problem that you can have, like a sore throat. Come on! On top of that, the relationship between weight and health is more complicated, I think, than most people understand. Health and weight have many variables. Everyone's different, which is why it's totally possible to be thin and unhealthy. I think we all have that one friend who can eat junk food for every single meal, but they're still this tiny little twig. Some top-tier medical schools are starting to be more proactive about this. Yale itself has started giving compassionate care trainings to their med students so that they can gain a more sophisticated understanding of obesity and an awareness of involuntary biases that might affect their work. Thanks for joining me for D News, guys. Also, some exciting news. This week, we're actually celebrating the launch of D News on the Test Tube Network, which is a Discovery digital network with lots of online shows about science and stuff that makes your brain bigger. My other show, Sex Plus, is about human sexuality, and it's one of the shows that's going to be on the Test Tube Network. So be sure to show it some love at testtube.com.